Hello, welcome to this mini lecture entitled Health, Illness and Disease. My name's Beth Pearce, I'm a registered nurse and I'm also a lecturer here at Griffith University. Today's mini lecture, by the end of it, you should be able to define the term health and describe the factors that influence health. You should also be able to identify the defining features of a chronic disease and differentiate them from acute illness. You should also be able to describe Australia's current status of health, including the current state of chronic disease in Australia. So what is health? Well, this is probably a definition or a term that you've explored on a few occasions throughout your studies here at Griffith University. We recognize that health is really more than the absence of disease, and the World Health Organization originally defined back in 1948 health as being a state of complete physical, mental, and social well-being, and again, that it's not merely the absence of disease or infirmary. And we still tend to turn to that World Health Organization definition when we talk about health today. That definition really recognizes that health is multidimensional, that it's subjective, that it comes from the person's own individual perspective, and that it encompasses well-being as well as quality of life. So in that respect, it's actually quite possible for a person who has a disease or has more than one disease to describe themselves as quite well or as quite healthy. We turn to the wellness continuum to try to explain some of that in terms of moving towards wellness when somebody still has a disease. And if you look at this continuum, what it shows you is that on one side, there's a high level of wellness, and that can be achieved really through having an awareness of one's illness or disease, by being educated about them, and being continuously growing in terms of somebody's understanding of their disease. On the other end of the spectrum, we have premature death, and what that comes with is, of course, illness, but also having a outward sort of exacerbation of symptoms and signs and experiencing quite a bit of disability. And that's moving away from having that awareness or education of one's own illness. There are a number of factors that influence health, and you've probably explored a few of them already in some of your other courses. You might also hear these referred to as the determinants of health. So these are things that determine how healthy a person is going to be. Genetic profile has a bit to do with it, so the hereditary nature of a particular illness. Some illnesses have quite a strong genetic link and can be passed down from generation to generation. Somebody's cognitive abilities, so their ability, again, I suppose, to be educated about their illness, to be aware of their illness, to take measures to either prevent illness or to manage that disease. Race, ethnicity, and culture. So there are certain races or certain ethnicities that are more prone to having higher rates of particular illnesses and therefore experience a lower level of health. And we'll talk about Indigenous health throughout this course and some of the diseases that Indigenous peoples are more at risk of developing. Age, of course, so as we age, we're more at risk of certain illnesses. Gender, certain illnesses are more prevalent in men than women or women than men, and a developmental level, so thinking back to our psychosocial course and how people develop over time, certain developmental points can trigger we can see diseases happening in those developmental stages more readily. Lifestyle, so thinking about our modifiable risk factors, things like exercise level, our nutrition, our practices like smoking, those are all things that have the potential to influence our health, and as well the environment around us. So certainly living in countries with high pollution rates or being exposed to air pollutants or environmental hazards can influence health. Socioeconomic background, so we do know that there's a link to poor health in areas of lower socioeconomic backgrounds or status, and as well geographic area, so living regionally, remote, or in urban centers can impact health in different ways. So in talking about health, we can't ignore the definitions around disease and illness. So we use the terms disease and illness quite interchangeably, and we will use them quite interchangeably in this course, but it's interesting to note that there is actually a differentiation between the two. So disease actually refers to alterations in the structure and function of the body and mind. And diseases can have a mechanical, a biological, or a normative cause. So our mechanical causes are things that cause damage to the structure of the body. So those might be something like trauma that actually then causes some sort of disruption to structure. Biological tend to be the causes, the things that naturally we age and we develop. So we might see that somebody experiences a slightly increased risk of osteoporosis as they age, or a higher risk of hypertension as they age. And so those are things that would impact potentially somebody's function. And then normative causes are the other causes of disease, and these are psychological. So they involve the body-mind connection, and they are physical changes that result from psychological disturbances. So those are the three areas that cause disease. We recognize that disease has an objective and a subjective manifestation. So that just means that we think back to the term objective from 1810 health assessment. Objective is those sort of outward signs that are observable. So a disease can manifest in that outward way. Whereas subjective is more about what it means to the individual. And that's where we do sort of the flip over to illness, where if we look at the actual definitions of disease and illness, disease are those alterations to structure and body, but illness is more about that subjective response to disease and how that person manages or reflects upon their own disease. So the impacts of disease are quite unique for the individual, and we know that somebody's response to disease is influenced by a number of factors. So again, when in the life cycle it occurs, whether it's a disease that's impacting a small child, an adolescent, somebody who's of working age, that can all influence the way in which they experience disease. The type and degree of limitation that's imposed by that disease, whether there's any visibility of impairment or disfigurement. The relationship between impairment and functioning in social roles. So again, if a disease strikes somebody of working age, or if they're the person who's the sole breadwinner in the family, it can certainly affect their role within that family and their role within society. The pathophysiology that causes the disease is also very much the way in which the disease will impact the individual, and any associated pain and fear that comes with that particular disease can make it quite unique for the individual. So diseases can be classified as either acute or chronic, and in 2803, Acute Nursing Practice, you explored all of those acute or self-limiting illnesses, diseases that tend to have a cause, they have a treatment, and they resolve. Whereas chronic conditions are a bit different, and they're the focus of this course. So chronic conditions are ongoing or permanent. They're often long-term, and they can leave permanent disability. They often cause irreversible damage in terms of pathophysiology. So once somebody acquires a chronic condition, it's very difficult to reverse the chronic condition. They require rehabilitation, and it requires a long period of care. And in many cases, chronic diseases are lifelong illnesses that require lifelong management or care. Chronic diseases are complex, and they have multiple causes. So where acute illnesses, we sometimes know the exact cause, a bacteria or virus. Chronic conditions are often caused by a multitude of factors that may be modifiable and may be non-modifiable. They often have a gradual onset, and they occur across the lifespan, although they're more prevalent as we age. They can have serious consequences in terms of quality of life, and they can create great limitations and disability. They're long-term, persistent, and as I mentioned earlier, can lead to gradual deterioration. And they can also impact independence, which is one of the focuses of this course, is around how do we manage people in a way, or how do we assist people to be most independent with their chronic illness, to take control over their chronic illness. Chronic illnesses are not usually life-threatening, but they are the most common and leading cause of premature mortality. So there's a lot of statistics around chronic disease and the impact that it has on lifespan. There are a number of risk factors for chronic diseases. So overall, if we look at the number of different chronic diseases, things like cardiovascular disease, chronic kidney disease, some neurovascular diseases, there are a number of common risk factors that often lead to these illnesses. Smoking, physical inactivity, alcohol consumption, poor diet, having a high BMI or being obese, and having high blood pressure. These are all risk factors that probably are not unfamiliar to you. They're things that you've learnt about before in your other courses, but certainly very relevant to this course in terms of the causes of chronic disease. So if we look at what's actually happening in Australia in relation to disease and specifically chronic disease, we can see that there's a huge expenditure that goes towards health each year. So $162 billion spent on health in 2014 to 2015, and that equates to roughly about $7,000 per person, and that's becoming more and more expensive. Now, that's within the sort of the context that we're actually living a lot longer. So we have one of the highest life expectancy rates. So we're probably treating people a lot better than we were years ago, and people are living longer. The number of heart attacks is decreasing, and the number of people with cardiovascular disease is going down, which is fantastic, along with the number of people who smoke and decreases in alcohol consumption. But we still know that 1 in 4 Australians have at least 2 chronic diseases. So even though all of these things are moving in the right direction, we've still got a significant number of people who are experiencing disease chronicity and who are experiencing disease over their lifespan and are needing treatment for that. We also know that persons in rural and remote areas, low socioeconomic conditions, people of Indigenous background, and those with disability have a much higher proportion, have a much higher prevalence of chronic disease. So it's more prevalent or experienced more readily in these populations. There are a number of modifiable risk factors that we talked about for chronic illness, and this slide just outlines those and puts them against sort of the regions in which people live. So if we look at major cities, inner regional areas, and outer regional areas and remote, we can see that there are some differences in the numbers of people or the prevalence of these risk factors. And we take that into consideration when we're planning programs and activities in and around addressing specific risk factors. We look at where the programs are going to be targeted and what the rates are of these particular risk factors in these areas. So that just leads us back to understanding that Australia has some very specific national health priorities. We know that there's a huge amount of money that's being spent on managing disease, but particularly chronic disease, because we know that 25% of the population, or 1 in 4 people, has 2+ chronic diseases. So the health priorities certainly reflect that. Our health priorities are to focus money, focus activities, focus programs on these diseases: cardiovascular disease, diabetes, injury prevention and control, cancer, obesity, asthma, dementia, arthritis and musculoskeletal conditions, and mental health. And you can see that other than really injury prevention and control, the majority of these conditions are chronic conditions or risk factors for chronic conditions. You'll be exploring many of these conditions in 2807, chronic illness management, and you'll be certainly looking at mental health in 2809. But in terms of moving forward, we want you to keep in mind your definitions of health and illness and well-being. We want you to be able to think about the differences between chronic disease and acute disease. So we're moving into a slightly different realm of illness. And we also want you to keep in mind just how prevalent chronic disease is in Australia. And hopefully from this mini lecture, you've gained some insight into all of those things. Thanks very much.